Hi, it's the nursing professor here. I want to share with you signs and symptoms of a CVA or stroke. There's an acronym that we need to remember, and this is for healthcare professionals and anyone, because identification of a stroke means time really matters. All right. So the acronym is BFAST, B-E-F-A-S-T. B stands for balance. That person doesn't have coordination. They cannot stand on one foot or pass a sobriety test. E stands for eyes. They might not be able to focus their eyes such that it can make purposeful movement with their direction. All right, face, usually there's a facial droop on one side. Arm weakness, same, usually one side. One side deficit is a clear symptom of a stroke. Sometimes a person might be able to raise their arm like this, but it's going to fall back down. That would be a sign. Speech difficulty. They're unable to speak, or if they can speak, they'll repeat the same thing over and over again because their understanding, their comprehension has been compromised by them having a stroke. And time, of course, EMS needs to be called right away. This person needs emergency medical services. Now, I have to pause because I just saw the most horrific story ever of a male worker who left work early, said he didn't feel well. He was driving home. He was found driving the wrong side of the road. He was pulled over by the cops. He could not answer questions. The cops called the drug recognition expert. That person did not go down the list of things that they should have. And this guy, once pictures were shown, once he got to jail, because that's where they took him, to jail as opposed to the hospital, it was very clear he was having a stroke. So this guy, unfortunately, had periods of time that lapsed where he could have had intervention that could possibly have led to a much better outcome, because there are medications that you can take or can be given to you within a 3 to 4 hour window of time. And from the sounds of it, as this guy's driving home from his work, there was time available had he gotten to an emergency room and have been treated. Every second counts when a person has signs and symptoms of a stroke. All right. When a person's in the hospital, of course, we have an NIH stroke scale that ranges from 0 to 42, and it hosts a whole host of other assessment questions are there. So that's when we're in the hospital. But the main purpose of this video is to share with people signs and symptoms of a stroke so that hopefully we can help prevent this from ever happening again. Once this guy got to jail, he was placed into a cell. They described that he was unable to even go through the entire booking because he was having a stroke. Ended up in the jail cell. He was incontinent of urine. Nurse finally was called and he was given Narcan. Of course he wouldn't respond to Narcan, and they later found he had no drugs or alcohol in his system. He was actually having a stroke. So students, I bring this to your attention because we need to make this more the public more aware, because time really does matter in these events. And when time is not adhered to as quickly as possible, we can get terrible, sad outcomes like this. Apparently the guy ended up being brain dead, and some reports say that he's actually died. I don't know. Again, I'm not trying to sensationalize this, but it really struck me today when I heard of all the barriers that he met in his care. People who knew that something was wrong, and he continued to not be treated appropriately. Students, please recognize the signs and symptoms of a stroke and know that you must respond right away. All right? Bye for now.